Clients want a total solution from a single source. So just a few years ago, we merged with a payroll company called CompuPay. Now branded as BenefitMall Payroll, we are the 5th largest payroll company in the country. And as brokers, you know having more products and services available makes you an even greater asset. But why payroll? Simply, it provides the next evolution of service that helps ensure full compliance in today's new healthcare reform world. Part of this evolution is our development of proprietary compliance tools. We call them AllCheck and AllCheck Pro. It's an integrated solution with our payroll system to make data entry even faster and more efficient. It provides clients with detailed analysis of how the Affordable Care Act impacts them. And clients are able to monitor their performance over time, and in the end, it's as simple to read and understand, yet flexible enough to run multiple scenarios to determine the client's best strategy. Let's turn our conversation to the Affordable Care Act, or healthcare reform. For the past 4 years, our role here too has evolved, from assessment to education implementation. And although implementation began over 3 years ago, many of the major components of the law just went into effect this past January. Let's start with public exchanges. Earlier, things like dependents to age 26 or unlimited lifetime maximums. But in 2014, we started things such as the public exchanges, which is a mechanism to administer the subsidies, and they're mostly individual focused. A lot of media attention we've seen recently talks about enrollment in that 5 to 6 million range. And many of that enrollment that has occurred has come with the help of our broker partners across the country in the public exchanges. But there's been other market reforms too that went into effect in January. Guaranteed issue and renewability, modified community rating, essential health benefits, lifetime and annual limits, a maximum 90-day waiting period, and other wellness and preventative benefits. Well, it's not so much the exchange enrollment that is of concern of brokers, carriers, and their clients. It's the makeup of those insurance pools. The key metric measuring the success of the Affordable Care Act will be the composition of that enrollment, just not the totals. And the question we have for pricing in the future is whether they will be sufficient to avoid adverse selection. How will the new Affordable Care Act mandates impact future premiums? And how will the continued delays and modifications to the Affordable Care Act also impact future rates? And finally, the employer mandate. Employers need to spend time now to prepare for the impact of this mandate, which has effective dates of either 2015 or 16, depending upon its circumstances, to help minimize any employer penalties. Over the past 4 years, at BenefitMall, we have published hundreds of blogs, legislative alerts, and white papers to educate our broker partners and their clients on the Affordable Care Act. And now more than ever, the true value of a general agency, and especially that of BenefitMall, has become exceedingly apparent with the onset of healthcare reform. 15 years ago, we never set out to be the largest general agency in the country. We set out to be the best. But by being the best, that helped us become the largest. And whether it's healthcare reform, payroll processing, defined contribution enrollment strategies, or just a simple explanation of a new carrier product, here at BenefitMall, our entire team stands ready to assist you and your clients in any way that we can.